Hi everyone, I'm Dr. Amanda. I'm a dentist at Dental Designs Clinic, and today we're going to be talking about Icon Resin Infiltration. It is a non or minimally invasive aesthetic treatment for improving the appearance and basically the aesthetics of your front teeth. So in general, when patients come in telling me that they want to make their teeth look a little bit nicer, what thoughts go in my head is what makes a nice smile, Is it the size of the teeth? Is it the shape of the teeth? Is it like a certain gap there? But ever so now, we have patients that come in complaining about that their teeth are too yellow and that the color doesn't look very, very even. So I have a photo in front of me. It's quite a pretty smile. It's taken with very, very good lighting. But you can also see some parts of the teeth that have these white patches here and here and here, all at the edges of the teeth. Some of the white patches are also in the middle of the tooth. But in general, if I didn't point it out, you would feel like, oh, okay, the teeth look very white there and it doesn't look so white at other areas like here and here. So, in fact, normal teeth tend to look a little bit yellow, and this is because the structure of our tooth is a little bit like an onion. On the outermost part, there's enamel. The enamel is the whiter part. It's also a little bit translucent. For some patients, it looks a bit more translucent than others, and that's why the yellow from that second layer shows through a lot. Okay? And what makes the teeth look more yellow than they really are probably the white patches that are all over the teeth. And because of this contrast between the white patches and the yellow, it gives this general sense that, oh, my teeth are really, really yellow, because that's where your eye wants to focus on. So what this patient has is generalized fluorosis. Fluorosis is a type of white discoloration that happens to your teeth while it is developing, meaning that it was already there when the tooth came out into the mouth. Okay? And there's nothing much that you can do about it, but we have this nice, fairly new technology that has emerged maybe in the last 10 years that has become more and more popular, and it is used to remove some of the white spots. So let's say in this case, I would feel that the white spots are generalized and they look quite pleasant. In fact, they kind of enhance the whiteness of the teeth, so that's a good thing. So if we look at another photo, something like this, you can see that in addition to the white patches in the middle, here and here, we also have some discoloration around the white patches here and even maybe here. So this is a more moderate type of fluorosis that affects the tooth more. And when the teeth are dried, so when the teeth are photographed using a special kind of flash, you can see the whiteness appears quite obviously and more distinctly. And using this kind of technology, we can find out where exactly the white spots appear and how best to manage them. Right now, I am playing a video showing the gel that we use during this treatment. Okay, so what Icon Resin Infiltration treatment is basically the use of a special green gel like this you can see in the photo. And this green gel is scrubbed onto the teeth for about at least maybe 5 times, and each time will be around 2 minutes. In addition to fluoride induced kind of white spots, we also have white spots that form, let's say, after doing braces. After you do braces, you have those little brackets on the teeth, and then sometimes if you don't brush too well and bacteria starts to accumulate around the brackets, you can have these white rings that appear on the teeth. And what these white rings are, we call them enamel demineralization. So when the bacteria on the teeth release acid, it sits on the minerals in the enamel, and then it leaches out minerals from the tooth. And when you do that, you change the crystal structure inside the tooth such that when light hits the tooth, instead of going through the tooth, it bounces off. And then that's why you get this kind of white appearance of the tooth. So you can see here, for translucent enamel, the light passes through the tooth very, very nicely, where the light arrows go through, and then only maybe one arrow of light goes out. When we have white spots on the teeth, what's the cause is that there are lots of porous spaces inside the white spot that is not a crystal structure anymore. And air is a different refractive index compared to enamel, and which is why when light goes through, remember physics, it just bounces off and it doesn't appear as nicely translucent as it should. And if you look at after the treatment, what the treatment does is to restore this correct refractive index of the enamel such that it's closer to intact enamel and not enamel with lots of these porous air spaces. So what resin infiltration means is that we have the special gel that we scrub onto the teeth. You can see it in the video. We place it on the teeth. Very rarely do you need any anesthesia for this treatment, so it's actually quite nice. And you rub it on. We leave the gel for about 2 minutes so that the gel is completely working on the tooth, and it takes about 2 minutes for us to reach to a certain depth where the lesion is at. So then we are rinsing it off, and then we will check to see is there any progress. We have a testing tip that releases some alcohol so that we can check if the white stains are going away. We do this about 5 times. So you can see the rinsing process goes on. Usually the cycle takes about 2 minutes to 3 minutes each time. And then after around 5 cycles, we will check to see whether the lesions have totally gone away. If they haven't, then we would repeat the process a few more times. And then at the end, depending on the depth of the lesion, we might need to use a little bit of filling material to resurface the tooth, or generally that is very minimally done. And so what's nice is that at the end of the treatment, the white spots do blend in quite well with the rest of the tooth, and we are able to achieve a really nice result. So usually at the end, we put this resin infiltration liquid on, and we do this for at least 3 to 5 minutes, making sure that the whole surface is wet. And you can see there's no drilling involved, there's minimal pain, and you are able to get a tooth that looks very much like a normal tooth with a very even shape. So if you have something similar that has been bothering you on your teeth for some time, the best thing that you can do is to come down to the clinic. Let me or my colleagues take a look so that we can help you try to identify firstly what kind of white lesion that you might have. Does it require any additional like a filling or something? But if it just happens to be, there's quite a lot of fluorosis or white demineralization stains on the teeth, then Icon might be a possible solution for you. I would say the downtime is quite minimal. It's easy to maintain. It doesn't really need to be replaced unless you have decay for some other reason. And it's a same day thing, meaning that you come into the clinic and we work on the teeth, and then you go out with and the teeth look pretty good. So yeah, hope to see you in the clinic soon.